methodological process. So one of my questions to each of you to reflect on is to what extent the kinds of work that you're looking at require systemic thinking in some sense, whether the tools are available, the conceptual and the methodological tools are available in your own disciplines to address those things, and maybe along the way, if you care to comment, to what extent a systemic view captures some of what is meant by holism. We talked this morning about indigenous perspectives, and we ended with Sheila Watt-Cloutier talking about everything is connected. These seem like quintessentially systems ideas, but not in perhaps enough of a specified way that we can do a lot with them scientifically, although they might mean a lot in terms of values. So it's kind of questions that are a spectrum of questions, implicit what I'm saying, between the methodological and practical questions and the role of values in the work that you're doing.
That's a big question.
Yeah, maybe it was a bit too big, huh? Especially with end of the afternoon, like... Please, anything that it stimulates to you, including the notion that maybe it's too big a way to frame the question.
Hopefully I can make sense of this. The tools, if you want, in terms of the knowledge, what we do in terms of healthcare policy, this is meaning, is that we create policies that then inform or support or regulate a system, and then when we find that the system does not quite work for a population, we put a patch into it. And we put a patch, and we put a patch. For indigenous people, the system is a bunch of patches, in fact, that does not quite articulate to a system. We've known that since 1969, because jurisdictional issues were documented in the Hawthorne Report in 1969 as the most important thing to be resolved. Now, that's a long time ago. So I don't think we need those tools, and the tools for solutions are relationships. And I think we know how to do relationships, but we've been in an era where those relationships were being subordinated to other interests, and maybe we've turned the page on that, but I think we need a system-wide approach, and we need to, those of us who are sitting at different tables, need to come together and ensure that that becomes the focus to advance healthcare policies and move it forward to try to address the inequities. So it's not a question of tools, I think it's a question of will.
Anybody else like to comment on that?
Well, I'm going to take another, different aspect to this question, and I'm going to think about the policies of researchers working in partnerships with communities. And I think, as many people have made the point today, communities, have huge knowledge, have great knowledge. They know what they would like. They know where they would like improvements. They know what the strengths are in the community. It's a classic thing from the participatory research literature that the outsiders see the negatives and the problems in a community. But if you go to community members, they know about the problems, they recognize them, but they also know about the strengths. So this is where your strength comes in your participatory research. I think one of the, and I'm stretching your question, Laurence. I think some of the policy changes that need to happen are the support for those of us who choose to undertake partnership research within universities. It's a very different life. It's a very different world. You're going to publish more slowly. You're going to have outcomes that include peer-reviewed journal articles, maybe high-level journal articles, but maybe lower-level journal articles, because you want to publish where it's relevant to the people you want to impact with the results, not just, the top, journal in the world. So when it comes to promotion and tenure, you're viewed very differently, but you have outcomes that have made a real impact in the community. One of the projects that was research, grant money that were used inside the Kahnawake School's Diabetes Prevention Project was to use baseline data, was to work in partnership with the elementary schools in the community, to use the baseline data that we collected from administrators and the teachers, but also the children themselves, to combine that with general guidelines in physical activity, for instance, and healthy lifestyles. And so the schools, in conjunction with the researchers, developed a wellness policy, which included a physical activity promotion component, included a nutrition promotion component. I mean, these are major outcomes. These are outcomes that are going to stay in the community. Another of our projects developed a health curriculum, which has now been undergoing revision based on those revisions. And again, it's Morgan Phillips, who comes from the community as a PhD student, is going to strengthen this health curriculum because it's being developed with community input and because community wants it. I don't know how that sits on my CV. We need to look at this. I know CHR is revising the CCV right now and giving us space, to put some of these outcomes. But this is major impact that is not your classic academic outcome.
Pierre, would you like to have reflections on?
I think I'd like another question.
All right,
I wish he asked.
Well, I mean, what I'm hearing from the responses so far, aside from the vagueness or broadness, what I'm saying is that it's less an issue of systems thinking, which people already have tools to do within their respective disciplines, and more an issue of values and of relational process, which can be impeded by many things. It can be impeded even within research institutions, can be impeded by different governments and so on. So I think this is a challenge, and I guess to turn that back to the conversation today, maybe Alex can address this. To what extent can indigenous protocols and sort of respect for and knowledge about certain kinds of processes help to address this issue of forging better relationships to allow this work to go forward?
So the foundation of any society, any nation is its values. And the values that we hold in our communities in 2016 are a blend of the values of our ancestors that come from the time of creation and as we evolved, and then the whole change of values that came from the genocide, assimilation, colonial process, and so many communities have this clash of values. They contradict each other at times, and we live in that milieu, and that's the foundation of our house. And so when the researcher needs to be aware and respectful of that situation. And so, and that first question, I think, has to go to the community of what's important to you. What do you want? And from where does that come? And that in itself is a long process. It's a very reflective process, and over time, the community can change, or the people participating are going to change, they're going to grow. We've seen that the Ganawagi of 40 years ago, when I came back home, to 1994 to today, just in the life of KSDPP, has changed, has evolved. There's a strengthening of Haudenosaunee values and practices and ways of doing. And so for the people outside of the community that want to come in and learn something and share something and collaborate with that, I go right back to Amelia's 2 ears, 2 eyes, and 1 mouth process. And it's about that listening and about engaging and asking the respectful questions around clarity. It's two trains moving at different speeds, and one's going to take its time, and that becomes the reality. And the larger system, the colonized system, is working on a clock and on a calendar, and that then needs to be negotiated. And at this time, it's give and take on both sides. But that then becomes an important challenge of how do you rush a process of human beings interacting with each other, learning from our dialogues among ourselves and with our partners, that we find something new and bringing that back around to the next. So no easy answer, the way I see it, but we plow through it, and we across the board in our communities with diabetes prevention work. That's what we've been doing. It's taking that time, and I think we've seen the processes changing, and they're going to change slow. You know, the Titanic couldn't do a 90-degree turn, right? You know, very, very slow, and because there's so many factors involved. But it's back to the values, and Indigenous values are going to be that relational, not only with one another, but with our mother, with all the life that grows, our relations on the earth and also in sky world. And it's all that ceremony. So we talked about a bit this morning about ceremony, that interaction of the spirit is what we need to allow to come to the surface, because that's then showing us our true direction, our true path. And then we all have to figure out, okay, so with what we know and what we do today, how do we make that happen in a good way? Because again, for us, it's those faces yet to come are what motivating us today.
Great, thank you. Would anybody else like to add anything on that theme?
Well, if I gathered your question correctly, I think there's, in my field of research, we're interested in really focusing on the quality of country food. The Aboriginal people have had an intimate knowledge of animals on the territory. They know where they are, they're eating, they're consuming the meat, so they can be actually great partners in trying to know more on the environment and the pollution of the wildlife. And I was in a meeting recently with a group of hunters, and we were discussing actually the phenomenal content of selenium in beluga skin. I think we discussed a little bit yesterday how maybe traditional knowledge could actually input on today's medicine. They know that it's good for their health. They've told me, you're measuring this compound in the skin of beluga. You're telling us levels are high and it's good for you, but we know it. Our knowledge tells us that it's important for our health and our spirits.
Thank you. So I think that's a good place for us to end on this notion that not only are we trying to develop the relational tools and value perspectives and engagements that allow us to deal with health inequities, but that this is an opportunity for knowledge exchange, for a two-way process, and of learning a great deal that will benefit all of us. And ending with climate change is certainly a way to highlight that common human emergency that we're all facing. So thank you.